So how is brain tumor surgery different from tumor surgeries anywhere else in the body? I will explain this to you in detail. If there is a tumor, for example, somebody has a tumor here, what doctors do is to cut the tumor from all the sides and remove it in one piece. If there is a tumor inside your abdomen, doctors open the abdomen and they remove the tumor by separating it from the surrounding structures. In brain, you cannot do that. That is because the tumor inside the brain is surrounded by very important structures and very eloquent structures. It may be surrounded by the centers for intelligence, the center for emotions, or the center for memory, or sometimes the entire tumor is wrapped by very important nerves. They are literally stuck to its capsule or stuck to the tumor from all the sides. In such cases, you cannot just go inside the brain and remove the tumor by cutting from all the sides. So in brain, we use what is called as internal decompression. And a lot of modern technologies help us in doing that. So take example of an orange. When you open an orange, you take a small incision on the orange peel, you remove whatever is inside the orange, and when you have removed that, the peel can remain intact, right? Sometimes you see that the orange peel remains almost intact. Similarly, when we are removing the brain tumor, we enter inside the tumor through a safe area, remove the tumor cells, keeping the surrounding peel of the tumor intact. And then we hold the peel and gently dissect it from the surrounding important structures. And that is how we remove the tumor and keep the structures intact. And that is why brain tumor surgery is different. It is more difficult in certain ways and it is more delicate because you don't only want to remove the tumor, but you want to keep the surrounding brain intact. You see, so this is how brain tumor surgery differs in essence from the tumor surgery in other parts of the body. The technologies which are helping us in 2026 today are vastly different from what we had about 10 years or 15 years back. We have instruments like CUSA. CUSA is ultrasound wave which is applied to the tumor cells, which removes the tumor cells without causing damage to the surrounding structures. To reach the tumor, we use computer guided navigation. Nowadays, even AI is helping us in reaching the tumor. How it helps? It helps because it takes us directly to the site of the tumor, the center of the tumor, without damaging the surrounding structures. With absolute precision, it is a precision surgery and it is more effective and has the ability to keep the patient intact at the end of the surgery.